there's a new and important warning from the CDC, an increase in infections with a drug-resistant bacteria called Shigella. It can cause fever, abdominal cramping, even other severe gastrointestinal issues. Let's talk about this with Regent at Large for the American College of Preventive Medicine, Dr. Chris Pernell. Doctor, good morning.
Morning.
I was just trying to ask you everything about this in the break. Like, does it affect kids? What does it mean?
Yes.
No antibiotic works. What's going on?
So shigellosis, which is an infection with Shigella, typically infects children from the ages of 1 to 4. But if you are an adult, which is a part of a vulnerable population, meaning you're living with HIV, you're immunocompromised, you live in a close contact setting, or you're a person experiencing homelessness, you have a higher risk of being infected by Shigella, and in particular with this extensively drug-resistant version or strain that we're seeing right now.
Shigella is nothing new. I mean, especially for people who are concerned about HIV and all of that. It's nothing new, but this is just one that is more drug-resistant, correct?
Definitely. Which is very concerning, right? Because in 2015, 0% of Shigella infections were due to XDR, or extensively drug-resistant Shigella. Now we see that with an uptick, about 5% of those infections are due to this drug-resistant form. And with this drug-resistant form, you have such antimicrobial resistance that we have no clear recommendation around a treatment paradigm that would effectively prevent if you had severe complications. Otherwise, it's usually a self-limited infection, and you just do oral rehydration.
The other thing we wanted to ask you about this morning is this new at-home test. It's for flu and COVID, which is a thing that we've been seeing people testing for, especially now that people are back out. You're not seeing as much mask wearing. People are traveling and whatnot. How the FDA has authorized this at-home test now, how accurate do they seem to be?
So these tests are pretty accurate, Kaitlan. The best way for people to understand it, if it's testing for influenza type A, it's nearly 99% effective at identifying a negative result, is 90% effective at identifying a positive result. If it's looking at the COVID-19 samples, that effectiveness is about 100% effective at identifying a negative result and 88% effective at identifying a positive result. So that's good. So think about that. You're at home, you can purchase this test over the counter, where during the flu season, you have these upper respiratory systems. You don't know if it's COVID, if you don't know it's the flu. This is a great way for a person to be able to tell.
But they're pretty expensive right now, right?
Yes, they are, right? And so that's the concern around accessibility. It's good that something is
$72?
Yeah, it's good that something's over the counter, but if it's out of your price range, then effectively it's not available to you.
Only from the manufacturer's website.
Yes.
Look, I take a test almost every day, and so oh, great, I'm good. I don't. But it could
we thank you for that.
But it could be flu.
Yes.
It could be, you could have strep. You could have a number of different things that you don't test for.
Right. It could be the common cold, right? So that's what I also
it usually is, right?
That's what I also tell people. But what's really good about this, Don, though, if you have this test and you're able to say, okay, this is flu, then you can get appropriate treatment for flu, or you can help to prevent the spread of flu. As opposed to if it is COVID, you can get appropriate treatment for COVID and go into quarantine or isolation. So that's why it's important for us in the United States to have more at-home rapid tests such as these available. In Europe, you can test the difference between RSV, flu, or COVID. So we're a little bit behind the game in this. So this is a good milestone for us.
Doctors feel about this, though, because you don't have to go in. Doctor?
Well, I'm a preventive medicine physician, so I'm in favor of health promotion and prevention. I know exactly what you mean, but we have to shift that paradigm. It's important to understand it through a public health lens and not just a traditional clinical healthcare lens. So this is good.
Doctor, thank you so much.
Thank you.
As always, for all of your valuable insight.